Our bodies are incredible machines, but as we get older, some parts can start to wear out. Think about our bones. They are the strong framework that holds us up, like the steel beams in a skyscraper. But for millions of people, especially as they age, a condition called osteoporosis can make these beams weak and brittle. It's like the strong, solid beams slowly become like chalk, easy to crack and break. This quiet problem often goes unnoticed until a bone suddenly snaps from a simple fall, or even just a cough. This is a very serious issue affecting so many of our beloved grandparents and elders around the world. Imagine trying to go about your day, but you're constantly worried that a small misstep could lead to a painful injury. That's the reality for many people with osteoporosis. The most common and dangerous injuries are vertebral compression fractures, which happen in the spine. Your spine is a stack of bones called vertebrae, and when they become weak, they can collapse under your body's own weight. This doesn't just cause intense pain, it can also lead to a stooped posture, making it hard to stand up straight, breathe deeply, or even walk comfortably. It can truly steal a person's independence and joy. These spinal fractures are more than just broken bones, they are life-altering events. The persistent pain can make daily activities, like getting dressed or cooking a meal, feel like monumental tasks. This often leads people to become less active, which unfortunately can make their bones even weaker over time. It creates a difficult cycle that is hard to break. The current treatments, like wearing a brace or getting injections of bone cement, can help manage the pain, but they don't actually rebuild the lost bone. Scientists and doctors have been searching for a better way to truly heal these fractures and give people their strength back. Now, consider this. What if we could use our own body's resources to fix this damage? What if we could tell our bodies to build new, strong bone right where it's needed most? This isn't science fiction. It's the frontier of medical science. Researchers have been exploring incredible new ways to mend these broken spinal bones from the inside out. This involves using a special kind of cell that we all have, a supercell that holds the key to regeneration. This exciting new approach could change everything for people living with the constant threat of brittle bones, offering a real solution instead of just a temporary fix. So, what are these supercells that could help us fix broken bones? They are called stem cells. Think of stem cells as your body's very own master builders, or a blank slate. When you are just a tiny embryo, stem cells are busy building everything: your heart, your brain, your skin, and yes, your bones. But even after you're all grown up, you still have some of these amazing cells tucked away in different parts of your body. These are called adult stem cells, and they act like a repair crew, ready to jump into action to fix damage whenever it happens. They are undecided cells, waiting for instructions on what to become. Now, you might be wondering, where do we find these helpful stem cells? You might be surprised to learn that one of the best sources is something many of us have a little extra of: body fat. That's right, the fatty tissue that we store around our bellies or on our hips is packed with a special type of adult stem cell called adipose-derived stem cells. For a long time we just thought of fat as stored energy, but it turns out it's also a rich reservoir of regenerative power. This is fantastic news because getting these cells is a relatively simple and safe process. Collecting these stem cells is much easier and less invasive than getting them from other places, like bone marrow. A doctor can perform a small procedure, similar to liposuction, to remove a tiny amount of fat. It's a gentle process that doesn't cause a lot of discomfort. Once the fat is collected, scientists can take it to the lab and separate the powerful stem cells from the regular fat cells. They can then grow millions of these stem cells, creating a large enough army of repair cells to send into the body to do their important work of healing and rebuilding tissues. The real magic happens next. These stem cells from fat are incredibly versatile. With the right encouragement in the lab, scientists can coax them to transform into different types of cells. They can guide them to become cartilage, muscle, or, most importantly for our topic, bone-forming cells called osteoblasts. It's like giving a construction worker a specific blueprint and telling them, "We need you to build a bone today." This ability to turn a readily available resource like fat into brand new bone tissue is a revolutionary idea that is at the heart of this new treatment for spinal fractures. So, how does this process actually work to heal a broken spine? Scientists in Japan have developed a brilliant step-by-step method. First, they take those adipose-derived stem cells that were collected from body fat. In the laboratory, they treat these cells with a special cocktail of growth factors and proteins. This mixture acts like a set of instructions, telling the stem cells to begin their transformation. Over a short period, the undecided stem cells start to change, taking on the characteristics of cells that are destined to build bone. It's a carefully controlled process of cellular engineering. The next step is to prepare these newly programmed cells for their mission. The scientists don't just inject the cells by themselves. Instead, they create a special gel-like scaffold. Think of this scaffold as the framework for a new building. The stem cells are mixed into this gel, which helps to hold them in place right at the site of the fracture. This is critically important because it ensures the cells don't wander off and that they are concentrated exactly where the new bone needs to grow. This cell scaffold combination is then carefully injected directly into the cracked and collapsed vertebra. Once inside the broken bone, the stem cells get to work. Guided by the scaffold and the natural signals from the injury site, they start behaving like true bone-building cells. They begin to produce the minerals and proteins, like collagen, that form the matrix of healthy bone tissue. Over weeks and months, they slowly fill in the cracks and gaps in the fractured vertebra. It's like a team of microscopic construction workers meticulously repairing a damaged wall, brick by brick. They aren't just patching the hole, they are rebuilding the structure from the inside, making it strong and whole again. The results from early studies are incredibly promising. When researchers tested this method on rats with spinal injuries similar to those in humans, they saw amazing results. The rats that received the stem cell treatment showed significant bone regeneration. Their fractured vertebrae healed and became much stronger than those in the rats that did not receive the treatment. Scans of their spines clearly showed new, dense bone tissue had formed right where it was needed. This provided solid proof that turning fat into bone isn't just a theory. It's a practical technique that can lead to real structural healing. The implications of this breakthrough are enormous. Think about the millions of elderly people who live with chronic pain and limited mobility due to spinal fractures. This new treatment offers them something that was previously out of reach: the hope of true recovery. Instead of just managing symptoms, we could actually heal the underlying injury, restoring strength and stability to the spine. This could mean the difference between someone being confined to a chair and being able to walk, garden, or play with their grandchildren again. It represents a shift from managing a chronic condition to truly curing it. One of the most wonderful aspects of this therapy is that it uses a patient's own cells. This is called an autologous treatment, and it has huge advantages. When you use your own cells, the risk of your body rejecting the treatment is virtually zero. Your immune system recognizes the cells as self and doesn't attack them. This makes the procedure much safer than treatments that involve foreign materials or donor cells. Using fat as the source is another major plus, as it's an abundant resource that can be harvested with a minimally invasive procedure, making the entire process gentler on the patient. While this research is still in its early stages, the path forward is full of hope. The next step will be to move from animal studies to clinical trials in humans. Scientists will need to confirm that the treatment is just as safe and effective for people as it was for the rats. If these trials are successful, we could see this therapy become a standard treatment for vertebral compression fractures within the next decade. It could revolutionize how we approach not only osteoporosis-related injuries, but also other bone fractures that are difficult to heal with conventional methods. Looking ahead, the future of regenerative medicine is incredibly bright. Today, we are talking about turning fat into bone. Tomorrow, who knows what we'll be able to do? We are learning to speak the language of our cells, guiding them to repair and regenerate our bodies in ways we once only dreamed of. This research is a powerful reminder that the solutions to some of our biggest health challenges might be hidden within our own bodies, just waiting to be discovered. It's a testament to human ingenuity and a beacon of hope for a future with stronger bones and healthier lives for everyone.